people should all be suspicious that why isn't other bloggers, saying all these things or picking up on this person? This person, I have proof to show. Okay. This person actually blackmailed me. From the first video that this person posted online, this person asked me to pay 2 million naira to let this whole thing go away.
Oh, you were asked by this particular blogger?
By Gistlover.
Gistlover, okay.
Yes, to pay 2 million naira to let it all go. Is my mom the government? Is anyone above the law? No one is above the law. So if I have done something wrong, no matter the position of my mother, she would not be able to do anything about it if I have actually done anything wrong.
Okay, so let's talk about where you went to school, your trainings, because we do know medical students spend a whole lot of time in school. I'm talking what am I saying? 5, 6 years?
5? No.
Oh, sorry. How many?
13, 6, 7 years.
At least.
At least
oh, wow.
6 years.
Oh, wow. So tell us
plus strike.
Okay.
And the rest.
Wow. Wow.
Yeah. Okay. So I graduated from College of Medicine, University of Lagos.
Okay.
And I had further training in the Soto's Family and Surgery Center in Texas.
Okay.
Also, I trained with American Academy of Cosmetic Surgery. We had the last training in Orlando, Florida. Yes, at Advent Health Nicholson Center, Florida. Also, I had trainings in hair transplantation and liposuction at ST's Center Plastic Surgery Center in Istanbul, Turkey. I also trained in Botox, fillers, and modern implantology, veneers. I've also had other trainings in non-invasive cosmetic procedures and aesthetic procedures as well. I also have a training in beauty therapy. I also an alumni of Enterprise Development Center of Lagos Business School. Yes.
Oh, okay. So when did you found Medcontour? Am I saying it right? Medcontour, right?
Yes, Medcontour.
Okay. So when did you establish the company?
2 years ago.
2 years ago.
Yes.
2018. 2018. Okay. So after you had all the schooling and everything, you just decided that it was time for you to go into business.
Well, I've always been in business. I've been in the beauty industry for about 12 years.
Oh, okay.
Yes.
So you just decided to take it up a notch?
Yes.
Okay. Yeah. So take us through when the whole drama started.
Okay, so the drama started in 2019 when we performed a procedure on a lady who passed on. So she had the surgery done with us. The surgery was successful, and I think about 3 days after the procedure, she had some respiratory symptoms, and we referred her to a center that had a respiratory unit, for expert management. And she was there with them for about 31 days, and she later gave up the ghost. May her soul rest in peace. Now, it was said online that I performed the procedure alone, and that it was my first time of doing surgeries, and that I just tried my hands on the surgery. I was alone in the theater, and the sister of the patient walked in and found her sister's body lifeless on the table. This is false because first the patient was awake for surgery. They also said we transferred fat into the patient's lungs, that she had an embolism. The patient never had an embolism.
What was she in for? What did she come in for? What was she supposed to?
She came in for a cosmetic procedure. Okay. I cannot exactly go into the details of what happened, but the surgery was successful. The procedure was done while she was awake, and I wasn't the only person in the theater. I had assistants in the theater. There were other doctors in the theater, nurses, anesthesiologists, anesthetic technicians, and other supporting medical staffs, And she was fine after her procedure until much later when she had that respiratory symptoms, and we had to refer her.
Okay.
And, it was said that she had fat in her lungs and all of that. Those things are false. And as at the time we had this procedure done, we had done well over 300 procedures.
Before this particular lady
Patient, yes.
So you've done 300.
Well over 300 as at the time.
So it was definitely not your first.
Yes, so it was very heartbreaking to see, but then because a life was lost, I couldn't share my side of the story. I just had to let it go, and this brought a lot of controversies. I had to stop work for a while, because it affected me psychologically, affected me, I was drained emotionally, psychologically, and I couldn't work for a long time. Yes.
Well, you went back to work after some time.
After some time, yes, I went back to work.
Well, is it possible for a surgeon to be alone?
It's actually not possible.
Is it possible?
It's not possible because first you need help to turn the patient around.
Okay.
So how do you move the patient? Who gives you drugs when you're doing the work? Who helps you wear your gown when you wash your hands? Who passes things around? Who takes care of the equipment there? Who passes the instruments to you? It's not possible.
It's not possible.
But those things were misleading. I couldn't share my side of the story at the time because of the circumstances surrounding the death of the patient.
May her soul rest in peace. May her soul rest in peace.
Yes.
Okay, so let's talk about the other one that happened. The one regarding the lady known as Omoti on social media. I know her as Omoti on social media, or we know her as Omoti on social media. We just heard that she had a surgery with you, and afterwards, about 2 months after the surgery or so, she still hadn't healed. Could you explain the whole situation with Omoti?
Okay, so I cannot go into details, like I said earlier, because of confidentiality, patient-doctor confidentiality. However, what I can say is that as at the time the lady went online to say that she had, when she said her waist or her abdomen was numb, and that was too tiny, and that her butt cheeks were not the same. She was 4 months post-op at the time.
4 months post-op, okay.
Yes, and skin numbness first is normal post-surgery.
Does it last for 4 months?
For some people, it takes 1 month. For some people, 3 weeks. For some people, 2 months, 3 months. For some people, up to a year. Some parts will be numb. It depends on your body. It depends on how. Yes, it depends on. No, it's not normal, but that's what is expected.
Okay.
Yes, and if you with proper post-operative care, that shouldn't even linger for that long.
Okay.
So you are supposed to have post-surgery massages that stimulates the blood vessels. It also, helps with tissue perfusion. That's getting oxygen to the skin, getting blood to flow around the area. So everyone needs the post-surgery massage, and some patients are not able to do all of this, either due to financial constraints or what have you, or distance, and so we tell them what to do. They tell us, I have someone who's going to do this for me at home, and then they go home, they stop doing it. Or you have some of them, you tell them you're not supposed to sit for about a month or 2 weeks or 2 months, and you find them sitting. You have some patients, you tell them you cannot smoke during recovery period or take alcohol, but these people go behind your back, drink alcohol, smoke, have delayed healing, and then try to say the fault is the doctors. And some patients miss or skip their drugs. So first, if you're on antibiotics, you're not meant to skip a dose of it or skip a day of your drug, your prescription. But then you have patients feel better after 4 days or 5 days, and then they just stop. Yes, and they just stop, and before you know it, they relapse.
So is that what happened in this case? Do you think that's what happened?
So if only our patients, came to us, to complain about the issues of because she never told us her abdomen was numb.
So you just found out on social media?
On social media, yeah. She never told us.
She never came back to you?
She never told us. She came back to us once,
okay,
to complain about the size, the disparity in size of the butt cheeks. But when we examined her, they looked the same. And then we also, tell our patients that no two parts of the body are the same. There would always be some slight difference or disparity in, every body part. So even if you think there's a difference, it's not noticeable. And also you need to give it time, because sometimes the swellings resolve gradually. One resolves faster than the other.
Okay.
So all we needed to do was reassure our patient if she came to us to complain when she had that issue. But it was on social media we found out, and we had to just educate the public on what it was, that was possibly wrong with our patient.
Okay, so what you are saying now is she could possibly she had relapsed in a post-op care. That's what could have happened, and she just came back once to complain about the butt cheeks, but afterwards she didn't come back anymore. She just kept on going on social media and saying,
yes, and and then people started saying that, this person has killed so many people, she's killing our girls are dying, people should stop going to Medcontour, it's a death trap. They said all sorts of negative things, and it was surprising to us because no patient has ever died on our table.
No patient has died?
We have never had any patient die on our table.
Okay.
But then we hear them say all sorts of negative things out there, and even recently we heard some blogger saying that we take out body parts.
This particular blogger was insinuating that you guys did rituals, basically fetish rituals. Like once you're operating,
unconscious.
Once they're unconscious, then you take parts of the body parts
of the patient and take out their
nails. How do you respond to this?
Okay, so first, when I saw that, I just started laughing because
why? That was a serious allegation.
It is funny because only a gullible person will believe such.
Okay.
First, our patients are awake for surgery.
All your patients are awake?
Yes, we don't put patients to sleep. I remember when I saw that post, I was actually with a patient, and the patient was like, "Are you kidding me? That I'm a living testimony. I was awake from my surgery. How is it possible?" Then, secondly, how is it possible to do such a thing when you have nurses, you have anesthesiologists, you have other people there, and then you start taking blood and body products for rituals?
Somebody might argue and say because you pay all these people and they will be forced into silence.
Now, thirdly, if you would ever need to do anything on a patient, first, if the patient doesn't shave before coming to surgery, you are advised to actually shave before coming for surgery. Now, if you don't shave, the nurses could get a surgical blade, help you shave. But if you don't want that, then it's fine. But we try to make sure you shave, you shower with antiseptic soap before coming into the theater. Now, if you have artificial nails, we try to tell you not to keep artificial nails when coming for surgery. And if you must, if you have to take out the one on your thumbs or your index finger. Now, this is because of the SpO2 monitor. So there's this tiny thing, I don't know if you've ever seen it in the hospital, that they use to check your blood gas level. Yes, you use it to check the oxygen level in the body. Yes, so that cannot stay if you have long artificial nails. So you have to take your artificial nails off. And what else? What do we need blood for? If we want to go for investigations, maybe pre-op investigations, we take your blood way before your surgery.
And everybody,
not
you
in
are
the theater.
For that process.
Yes, not in the theater.
So you're saying all this body fluid or anything, you don't have any reasons to take that except what you just explained.
For Christ's sake, this blogger has been going on and on. People should be suspicious that why isn't other bloggers, saying all these things or picking up on this person? This person, I have proof to show. This person actually blackmailed me from the first video that this person posted online. This person asked me to pay 2 million naira to let this whole thing go away.
You were asked by this particular blogger?
By Gistlover.
Gistlover,
Yes, to pay 2 million naira to let it all go away for him or her to support my brand. The moment I did not pay, from that night that we had that conversation, he reduced it to 1,500,000, 1.5 million.
And you have this proof?
Yes, I do.
Okay.
And I can show it to you right now.
Okay.
Now, the moment I refused to make that payment, by morning when I woke up, this blogger already posted something else and kept posting and said, oh, this person has even finished her, she's a quack, she's this, don't worry, you'll see more, my inbox is full full of your atrocities, and started getting pictures online and just putting things together and saying that, oh, this is your work, this is what you've done, you've destroyed so many lives, and then trying to make people feel like he or she is trying to help Nigerians by fishing out the quacks, not knowing this person is doing all this out of the pain of not being paid the money he asked for. He or she asked for.
Okay.
Yeah.
Okay, so did you at any point get Omotie arrested?
Yes, I wanted her to, because all she's been posting about me first made FCCPC come to, because she made that.
I was going to ask, because your business was short.
Yes, she made a false allegation. And FCCPC, without even trying to call to find out if those things were true, or even at least checking what my name was, they addressed me as Anu Fela. They didn't even do any background investigation. So they just acted on what they saw on social media, broke my door because the facility wasn't even open at the time. Broke the gate, broke the door, went upstairs, took videos, carted away with things, took videos of the place, put it up on AIT, on TVC, and different, radio stations, media houses carried it, and then they took, it was all over the newspaper as well, that, oh, they've sealed this facility is killing people, and, that brought a lot of negativity to the brand, and then made it look like, oh, these people are really doing something wrong. Now, I, reported this to the Nigerian Medical Association, and they know that what these people have done is wrong, because they have no right to regulate medical facilities.
Oh, they have no oversight over medical?
No. They are meant to, first, if you buy, maybe you buy expired milk from ShopRite, that is what they should be doing. They go and that's what it should be, consumer protection. If there's a problem with the medical facility, or you feel you're doing something wrong, you're supposed to go through the appropriate channel. We have the Medical and Dental Council of Nigeria.
And
you write to them. You write to them. You write to their other bodies regulating, medical facilities. And the association stated all this, and also told them, because they said that I wasn't a doctor, stated to them that I was a fully registered doctor with the Medical and Dental Council of Nigeria, and also that I was, a member of the association, and that the facility is also registered with the Ministry of Health, and they are not meant to, take these steps, just break in and all of that, or even try to interview doctors, and try to meddle in medical, So it was a whole lot of stress, a lot of trauma to my person and my brand.
Okay, so all this talk of you having a herbalist or somebody somewhere, or your friends being members of a fetish society or anything, what do you have to say?
First, what would be my reason for doing all of that? Would I say I am looking for blood money or something? My profession pays me enough to do things. I believe I am very comfortable.
So you don't need any.
So if, and my patients, each procedure is more than enough to feed my family for a month. So why would I want to go down that route? I'm not someone who sells hair on Instagram, or someone who sells shoes, or I'm not saying that it's not a good line of business, but I'm saying that I do not have a reason to do such. what I do, I have the demand for it. So why would I want to go down that route? I don't even have my pastor's number to start with. How much more going to a herbalist to do something, or because I saw it, I just
you are a Christian now, so you don't believe in things. Is that what you're saying?
Oh yes, I am a Christian. I don't believe in such.
Okay.
Yes, and I believe in opening my mouth to pray if I have issues. I don't even need to go to a pastor to pray for me. They can join me in faith, but I believe when I open my mouth to ask God for something, He will do it for me.
Okay.
Yes.
So at the beginning, you mentioned your mom.
Yes.
Your mom was a strength, is a support, is a pillar for you. But this lover also brings your mom into the picture. Says anytime you have issues, like you've had several issues, according to them, you've had several issues in the past. That anytime you have these issues, your mom comes and sorts wherever she wants to and clears all this.
First of all, is my mom the government? Is anyone above the law? No one is above the law. So if I have done something wrong, no matter the position of my mother, she would not be able to do anything about it if I have actually done anything wrong. That's one. Number two, I don't even get her involved in anything I do. I don't get her involved because I don't want to stress her. I don't let her, she doesn't even know all the drama going on social media. I don't bring her into my issues at all. And I've not had any reason, to get her involved in anything because I don't have, aside the issue of FCCPC being in court, I don't have any police case that I will say I want to call her. And besides, if I go to any police station, I'm a doctor, for Christ's sake. I'm not a traditionalist or someone who just picked up the trade and started doing it in some shop, and I need to, hide under someone's, I don't need that. If anyone comes to me and they feel I am not a doctor, then they go to the body that has certified me to be one, to complain. I don't have any issues, and I don't think I need my mom to help me sort any issues out. I'm not a child.
You can always take care of your own problems when they arise. Okay, so let me ask you, in conclusion, what would you like to happen now? I know you said your brand has taken a hit, like emotionally, professionally as well, and mentally for you as well. What would you want now? What would you want to happen now that you said? I know you still have. You said you still had the case in court.
Yes.
So what would you want?
Locked up the facility.
Yeah. What would you want to happen now?
So I just wish all this would go away. I wish to change the narrative, because once you type Dr. Anu, you see all sorts of negativity out there.
And you're saying categorically that none of this happened.
Yes, and that's because I have not been able to share my own side of the story, because my profession doesn't exactly allow me to. Also, I know that I see a lot of people say that I'm not showing sympathy, but the truth is, as a doctor, you're meant to be empathic, not sympathetic towards things. So you cannot exactly show so much emotions. It doesn't mean that I don't feel what others feel. It doesn't mean I don't feel their pain. At the end of the day, I am a mother as well, and I would pray never to lose my own children. So why would I want anyone to go through any sufferness or want them to lose their family? It's not my wish. I wish that patient never died, and I wish most of these things never happened. I wish our patient contacted us and we were able to reassure her instead of going to social media. And I also wish, moving forward, my patients would try to at least consult us, before going online to say things about their treatment.
Okay. Thank you very much, Dr. Anu. So before you go, I just recalled another video that came out of a lady who didn't show her face, who showed that she had some complications on her breasts, and she said it was because this was a result of your work.
So the truth is, like you said, the patient didn't show her face. So if my patient has an issue, she would actually come to the hospital to see me or see any of my team, a member of my team, or call me, because my numbers are on, my phones are going through. If at any point my number didn't go through or I didn't pick up my call, I'm sure I always call my patients back if I miss the call. And for some reasons, I may be in a meeting or like I'm here right now, you don't expect me to use my phone, but I would always call my patients back. So if my patient has an issue, I believe my patients will call me or at least come see me, and then I will sort out their issues. And until I see the patient's face, though we have some patients who has similar issues, but this patient, I've not seen the patient's face, so I don't know.
So you don't really know. You can't tell if it's
I need to be able to identify my patient to speak about whatever it is that is wrong with them.
Okay. All right. Thank you very much.
Regarding Dr. Anu's query of the FCCPC's closure of her office, the Commission, in a statement released on April 14, 2020, explained why that action was taken. The Commission CEO, Tunde Irukera, in a tweet further revealed that under the law, it had the right to investigate the claim against Dr. Anu despite her being a medical personnel. Legit.ng also reached out to Omoti to hear her own side of the story, but she declined to comment on this matter. We also reached out to Gistlover blog, and as at the time of compiling this report, no one from the blog had gotten back to us.